All right. Hey there, everybody. Welcome to the Money Club with Lisa Duke. Today, my guest is Tom Bouvier, who is our Cajun Medicare expert.
Yes, yeah.
Yeah. And I'll let you, if you don't mind, I'll let you introduce. Well, before I do that, Tom and I met. We are both in the same BNI group down here on the Treasure Coast area of Florida. So I've been seeing him either in person or via internet once a week and hearing all about his Medicare expertise. And we had some questions in the group specifically about Medicare. So that's why I put this book. First of all, because Tom is a good guy and he's knowledgeable and he's entertaining. And then also because we had questions in the group specifically about Medicare. That's why I put this together. So Tom, if you just will take a moment and introduce yourself, that'd be awesome.
Okay, thank you so much, Lisa. I really appreciate you inviting me. I know you're an educator. You have great insights and deep knowledge, not only of finances and how the financial world works, but the psyche of people and how they relate to finances. And in my interactions with you as well, I certainly want to say she knows her. Lisa, you know your stuff, and you're really a great coach, and helping a lot of people in the financial world. And Medicare does come into play when people are eligible for it. So again, my name is Tom Bouvier. I'm an independent licensed insurance broker in the health insurance world. I do focus, and my main focus is on Medicare. I've been doing it over 6 years now as an agent, a trainer, training coordinator for some big companies, but now I'm an independent broker. So I represent almost all the insurance, Medicare insurance carriers out there. Our agency also handles life insurance, long-term care, final expense, a lot of other ancillary insurance products, everything except for homes, automobiles, and cars. You know, that's called the property and casualty. Anything health related, I'd be able to help you with. And all of our services, anytime we meet with people or talk with people, it's always a no cost, no obligation consultation. I love to educate people and help them see what their options are. So that's who I am. Got my license in 2014 and have not looked back. And it's what I'm going to be doing, until I personally retire. But I really love what I'm doing, helping people and navigate the rough waters and the very confusing world of Medicare, because there's a lot of things changing every year with government rules and regulations. So, oh, you're on mute. Oh, you're on mute.
I shouldn't have muted myself because I know I like to talk. I was just going to say one thing that comes to mind immediately as a question for what you do is, if Medicare is free from the government, what is there to sell?
Very good, and you're certainly a great lead-in. So thank you. So and there are some great supplemental products, because the original Medicare, as I'm going to explain, does not cover everything. So Lisa, if I may, I thought I would kind of give everyone a little history or a story on how I first learned about Medicare. So if you rewind, I think 42 years ago, I'm 58. So when I was 16 years old, I got my first job at a pizza parlor. It was called Shakey's Pizza on Airline Highway in Baton Rouge, Louisiana. And at that time, the minimum wage was $2.65 an hour. Now, before you all start laughing, in today's world, $2.65 equals about $10.42, purchasing power. So for a 16-year-old, now, with their first real job, I used to cut grass and do a lot of work, to hustle to try to make some money. But this was my first real job. So I remember my first paycheck, and this is how I discovered Medicare. And it's a true story. And I think you know where I'm going with it. So, I got out my little handy dandy calculator as a 16-year-old, and I was working I was part-time, working Thursday night, Friday and Saturday, and sometimes on Sunday. So I was putting in about 20 hours a week. So I was thinking 20 hours times 2.65 equals $53. Now
It'll be a
again,
big
before you laugh,
disappointment.
yeah, oh, that's right. Now, again, before you laugh, $53 then equals about $208 in today's world. So for a 16-year-old kid, works the weekend, he comes back with $200 in his pocket. That's what I thought. So it's not bad. But so 53, and I got paid every 2 weeks. So 53 times 2, I was expecting to get $106. So my first paycheck comes, I rip it open, I look at it, and I think, it's like $79.26. I was like, oh, what in the world? I better go to the manager. Then I began to look at the line items. I said, well, he's got the hours right, 20 hours times 2 weeks. I had 40 hours. He got the dollar amount right, 265, and the total 106. And then I began to see the line item deductions. The federal government. I think, oh yeah, I think I heard about federal taxes. The government's going to get their share. Then I saw FICA. I had no idea what FICA was, F-I-C-A, and that's Social Security, by the way. And then I saw Medicare, and I had no idea what Medicare was. Well, that's Medicare, pronounced in a Cajun French. And then I believe in Louisiana, we had a Louisiana state tax. So I had 4 deductions. So after all that, 40 hours, it really put me down to about $2 an hour, take home pay. And so as I began to understand what it was and ask questions, I found out that money was being taken out at an early age, at 16, for Social Security, FICA, so that one day, if I retire and don't die, I might get a Social Security benefit check or monthly to help me supplement my income. And also the Medicare amount was being taken out so that one day when I turned 65 or qualified other ways, which I'll explain, I would have a health insurance. And prior to 1965, Medicare did not exist. July 30th, 1965 is the beginning of Medicare, coming on the 55th anniversary. So what is Medicare? It's a federal program that offers health insurance to American citizens and legal residents. And American citizens is understandable, but a legal resident means you would have to be legally in the United States for 5 consecutive years. And those 5 consecutive years have to be exactly when you're going to apply for Medicare, at that point. So who can get Medicare? Okay, I gave one example that you have to turn 65. I do have people see the ad on my car, or they see my business card and they say, hey, I'm 35, I lost my job and I'm in great health. Can I get some of that Medicare insurance? Well, you're not 65 and you're great health and you're not on disability, so no. You might be able to qualify for Medicaid, but that's a whole different thing. That's a state-run program with federal funding. So who can get Medicare? Basically age 65 or older, and again, a U.S. citizen or a legal resident. You can be younger than 65 if you have a qualifying disability. And what that means is, let's say you're 35, 40, 26, and anything under 65, and you qualify for Social Security disability and cannot work, after 24 months, they will put you on a full Medicare, okay? And on the 25th month, you would qualify for Medicare. Or a third way you could qualify for Medicare is if you're any age and you have diagnosed of end-stage renal disease, and that's kidney failure. Okay, many people go on dialysis for kidney failure. So if you have end-stage renal disease, you would immediately qualify for Medicare. And ALS, which is Lou Gehrig's disease. I think on end-stage renal disease, you have to wait 90 days, but then ALS. So those are the way you qualify. And so once somebody qualifies for Medicare will send them a card. I'm going to see if you can see that. And that's called, is that seeable?
Yeah,
Red, white,
yeah.
there we go. So that is what a Medicare card looks like. It's a little fuzzy, but it's called the red, white, and blue card. And when you turn 65 or you qualify for it, you would get that card. And on it, it has the person's name. It has a Medicare ID number, which is 11 random letters and numbers. And up until a couple of years ago, it used to have a person's social security number on there with a letter. And then it says on there, hospital Part A and medical Part B. Okay, and so with this red, white, and blue card, this is called Original Medicare. Okay, Part A and Part B. This is what came out in 1965. And again, it's regulated by the federal government, an agency called CMS, or Centers for Medicare and Medicaid Services. And again, people would qualify for that. So as I know Lisa was saying, well, when people get on Medicare, what's there to sell? What, don't they have it? And this is a common misconception, is that if or when people get their red, white, and blue card, they think, woohoo, Medicare's still here, number one.
Yeah.
Number two, I made it to 65.
Everything's free now.
Everything's free now. So we think we have the granddaddy of all granddaddies health insurance plans. And unfortunately, that is not the case. There is a cost even after you get your Medicare. And let me kind of explain it. So again, I'm going to go through the ABCs here. A for Medicare Part A is hospitalization, and that's on original Medicare card. Medicare Part B is for medical. So Medicare Part A typically does not cost anything on a monthly basis once you get your red, white, and blue card. So they call that premium free Part A. And the way it becomes premium free is because back when I was 16 years ago, back to my story, they began to take out money at 16. And you can imagine, whatever the small amount they were taking out 42 years ago, and all throughout the years, it had been going into a pot called Medicare. And now they say when Tom Bouvier turns 65, he's going to get Medicare Part A for inpatient hospitalization at no cost to him at all. Okay, so, but then there's the medical side of it, Medicare Part B, and that covers, and I'm going to talk about doctor visits, etc. Hospitalization, of course, if you go into the hospital. But Medicare Part B does carry a monthly premium. Yeah, and most people, again, think Medicare would be free, but that monthly premium is the standard amount for 2020 or 2020 is $144.60 per month. And it could be more or less. Now, if someone has very low income, they qualify for state assistance through Medicaid and other programs, they may have that premium paid for by the state or for some agency. And then if they make a higher amount of money, $85,000 or more, they look back 2 years as an individual, or $170,000 if spouses or filing taxes together, and up, their Part B premium would actually be higher. It's called the IRMAA, IRMAA, Income Related Monthly Adjustment Amount. And so some people may be paying $144.60 per month, and that's the majority of Americans. Some are paying zero. Some are paying $350 a month or more for their Part B premium, only because they've made more money, looking back. So, any questions so far? From Lisa, anyone else?
Amanda and Kay, y'all are both muted, so if you have any questions, just unmute yourself and chime in. Actually, and I see.
Oh, I was just saying I don't have a question.
Yeah, go ahead.
Oh, I don't have a question. I was just unmuting myself to say I don't have a question. Yeah.
Thank you, Amanda. I apprate it.
At least we know you're still listening.
Yeah, and I like your big A symbol. That's for Medicare Part A. All right. So now the second biggest misconception is not only that once I get Medicare, it's going to be free, but also once I get Medicare, it's going to cover every single thing that could happen to me health-wise, whether I want to get elective surgeries or different type of, I want to get an annual physical like I've been used to. There's a lot of things not covered under Medicare. People say, my teeth are falling out, I'm having health issues because I can't eat healthy food. This Medicare certainly is going to help buy dentures for me and give me dental, and you know, I need glasses. Certainly Medicare is going to buy glasses for me, right? Actually, no. There's a lot of things that are not covered under this beautiful, wonderful red, white, and blue card. Again, Part A is for hospitalization. It includes inpatient hospitalization. It includes hospice care, which is basically end of life when they think a person life will terminate within 6 months. They can go on what's called hospice. It includes skilled nursing facilities, because many times people will go into the hospital, break their leg, their ankles, whatnot. They haven't walked for a couple of weeks or however long they're in the hospital, and then they have to go into therapy for 2 or 3 or 4 weeks to learn how to walk again. So that's called skilled nursing facility. And so Medicare pays a portion of that, or Medicare covers, Part A covers that. And again, home health agencies, when you're not able to get out of your home, the doctor can order maybe 30 days of home health or 60 days of home health, where people come to your home. And so that is covered under Medicare. Okay, and then Medicare Part B, as in boy, for medical, that covers physician services like doctor visits, lab tests, durable medical equipment like a walker, crutches, CPAP machines for sleep apnea, all the different, you see medical supply stores everywhere here in Florida. It would cover those durable medical equipment. Diabetic testing supplies are covered under Medicare Part B. Also ambulance, emergency rooms, physical therapy. So all the medical services outside of an inpatient hospital or skilled nursing facility would be covered under Medicare Part B. Now, if you notice, there's one thing I did not say, which a lot of people are have to utilize, and that's ongoing maintenance medication. Well, what about my blood pressure pill? What about my arthritis pill? What about my pain management medication? I have to take that every day. Doesn't Medicare cover that? Well, they did come up with a Part D. D for David, D for drugs, D for Duke. But yeah, Lisa Duke. Medicare Part D, that came about in 2006, actually January 1st, 2006. They came up with a Medicare Part D, and so private companies were able to put together prescription drug plans, and I'll be talking about that here in a moment. But again, Medicare Part A and B is called Original Medicare. You qualify by being 65 and over, qualifying disability, etc. And there are some costs involved. You have the usually premium-free Part A and $144.60 Part B. Okay. Now, again, another misconception, I think actually in line with what Lisa said, is when people get their red, white, and blue card, they think all my medical needs, if I go into the hospital, I just hand them my card and nothing comes out of my pocket. Well, I wish that was true, but it's not. And I don't want to show you the paper because I know it's not going to show up. But if you were to only have Medicare, Original Medicare, A and B, and you were to go into the hospital and you handed them your red, white, and blue card, and you would have an immediate day one deductible $1,408. You would be responsible for whether you stayed in the hospital for 1 day all the way up to 60 days. That's 2 months. It would be $1,408, and that would be that's your cost, your out-of-pocket cost. Now, if you're in the hospital for 60 days and all your bill was $1,408, that's not bad. That's actually seems pretty good. However, if you're only in the hospital for 1 or 2 days, inpatient, admitted, you would immediately pay that $1,408 deductible. And then if you leave and don't go back in the hospital for another 60 days after that, and you went back into the hospital, say 3 months later, boom, you hit with another $1,408. Okay.
So that's
Now,
not a daily cost. That's just a, like, you got admitted to the hospital penalty.
Yes, that's a good way to put it. Got admitted to the hospital penalty, and it's technically called the deductible.
Okay. Yeah.
But it's a deductible during that time frame. So again, if you were in the hospital this month and then you got out, and now if you went back in the hospital within 60 days, that deductible's been met. So it covers you. If you go beyond 60 days, you would owe that deductible again if you went back into the hospital. Okay, now if you go beyond 60 days, from days 61 to 90, you would begin to now start paying. You would pay $365 a day for days 61 through 90. Okay, those co-payments. So if you're in the hospital for 3 months, you could technically owe up to $10,560. That's what you would owe. And then from days 91 to 150, you would owe $704 per day. And this is where it is a per diem cost share with your Medicare. You would pay $704 a day, and up to that, potentially up to $42,000 in cost. 151 days or more, you pay all the cost. What? Exactly. So Lisa,
I have a feeling that the Medicare for All people do not know about this.
well, no, most likely not. And even a lot of people who, get, when they're starting to turn 65, their mailbox gets filled with brochures and flyers and unsolicited calls and knocks on the door, and their family and friends telling them what they need to do. The confusion can be very, very great out there. And that's why having a local licensed, trusted advisor that will not charge you a cost for consultation for Medicare options is very, very important to get it right when you go on to Medicare. And I'm kind of laying the groundwork that with original Medicare, you could potentially owe unlimited amounts of money. There's no ceiling, no cap, no out-of-pocket maximum on what an individual could owe if they only have the red, white, and blue card. And that's for hospitalization. And then if they go into a skilled nursing facility, Medicare does cover the first 20 days. And after that, it would be $176 a day up to 100 days. So again, you could potentially owe another $14,080 just for hospitalization plus skilled nursing facility. Okay. Now,
this is really disappointing. Can you also help us move to Canada?
Well, no, I think you would have to do that on your own. That's funny though. Now, that's only Medicare Part A. Now, here's where the cost could really be extreme as well of what a person could owe if they only have original Medicare, and that is the cost for Medicare Part B. So we learned that Medicare Part B covers the medical, doctor visits, outpatient issues, durable medical equipment. And on Medicare Part B, you would have an annual. So at the beginning of each calendar year, you would have to pay the first $198 if you went to a doctor visit or picked up durable medical equipment or diabetic supplies or whatnot. And then after that, you would pay up to 20% for all approved amounts. So many people, if you ask them, what do you know about Medicare and what it covers? They say, oh, Medicare pays 80 and I have to pay 20. And that's where they get that idea. And it's correct in a small way, but it's not fully correct. So again, there's no limit to what a person might owe. If they have some catastrophic year of a few hospitals visits, skilled nursing, a lot of outpatient situations, doctor visits, follow-up visits, MRI, all these things. A person with original Medicare only, if their bills turn out to be $500, $600, $1 million, which is possible these days, they potentially could be on the hook for a couple of $100,000. Does that make sense?
Yeah.
So I'm laying the groundwork of what the options are, and you ask, well, what's there to sell if somebody from Medicare? Well, and that's where I can talk to you now about the different options, okay? And again, anyone, if you do have a question, feel free to unmute yourself and stop me and ask a question. I'd be happy to. Okay, and so what I typically do for people who are either new to Medicare, or even if they're, have Medicare, but they don't really fully understand it, I like to start at the beginning, and as I kind of did tonight, and talk to you. And I use this wonderful little Medicare trifold that Gary Owen, our agency owner, put together. It's Medicare 101, understanding the options of Medicare. And I think I've done a good job to talk to you about Part A for hospital, Part B for medical. This would be what someone would get when they have their red, white, and blue card. They would have hospitalization. So, Lisa, since you're a financial coach and you were advising them, they're turning 65, getting on Medicare. Well, I've got Medicare, and now that you know all the additional expenses and the potential out-of-pocket, no out-of-pocket maximums that they could owe, do you think you would advise them to get something to help them with those costs?
Yeah, that makes perfect sense.
I know you would. So around 1965, when Medicare began, insurance companies came up with a wonderful idea. And they created a product. They said, these people, called Medicare supplements, but they said, these people are having all these out-of-pocket costs, even though they paid into Medicare and they have their red, white, and blue card. They're going to the hospital and they're whacked with $1,408. It was different at that time. And these other 20% cost shares with no maximum out-of-pocket, potentially owing a lot of money. So they said, we're going to create an insurance product called a supplement. So it's very similar to a supplement vitamin that you eat. That's supposed to be not your total nutrition. That's supposed to supplement the food you eat. So the food you eat is like Medicare. So these supplement plans, they say, we're going to charge people an X number of dollars. And let's just put a figure of $150 a month. And so if they do go to the hospital, we'll pay that $1,408. Excuse me. If they do go to their doctor visit, we'll pay the $198 deductible, and we'll pay the 20%. And so they came up with this financial product, insurance, called Medicare Supplement. And this was the original things that people would buy. They'd have their red, white, and blue card, and they would get a supplement. It would help cover those costs. If they had and there's many different types of Medicare supplements. Some pay more, some pay less, and that determines your monthly premium. You might get the granddaddy of them all, previous to this year, was called Medicare Supplement Plan F. F as in Frank. And it would cover basically everything that Medicare Part A and Part B did not cover. All your cost shares that I just talked to you about, okay? And then there's other ones from there that go down in what they pay, and the premiums would go down as well, okay? So again, even back in 1965 and 1970, 1980, 1990, people were walking around with a Medicare card and a Medicare Advantage, a Medicare supplement card. But if they bring that to the pharmacy, no luck. Not going to cover your prescription drugs. Again, that's where Medicare Part D is in David, or D for drugs, came in. Yeah.
So just to make sure I'm tracking, the Medicare supplements A and B, correct?
Correct.
So A, which is the hospitalization, B, which is your doctor's visits and your medical equipment. So that makes sense that it wouldn't cover you with prescriptions.
That is correct, because neither Part A or B covers ongoing maintenance medications.
Yeah, and I'm tracking. So you said minimum, unless you're super low income and you don't have to pay, or you're high income and you pay extra. We're talking $144 a month for A and B, plus $150 a month for what A and B covers but doesn't cover. So we're up to like $300 a month, and we haven't even gotten to prescriptions.
That's correct.
So this is going to be a significant piece of a retiree's budget.
Well, for some people, it is very significant, and there is an option 2. So I'm still
Okay.
on option 1, but no, you are tracking very well, and you're right. There, if you get with Lisa Duke early in life, she'll get you to the point where $300 is maybe a drop in the bucket for you for your health plan. And I say it in all sincerity, many people I deal with, they're living on Social Security. Some of them, they're living on $1,200 a month, and that's it. That's all. They have nothing else. And so, your heart goes out for those people, and there are other options, which I'm going to talk to you about. But you're right, it can be pricey. Now, the Medicare supplement with that Medicare card gives you the greatest freedom to go to any doctor, any provider, any hospital around the country. So there's great freedom and liberty. You're in the driver's seat for your health. You don't have to have a primary care doctor give you a referral. You don't even have to have a primary care doctor. You can pick up the phone and go to Mayo Clinic, and you can go to Moffitt. You can go anywhere across the country, as long as they accept Medicare and Medicare assignment, and they accept Medicare rather than you give them your Medicare supplement card. It would cover the majority of the cost, depending on what plan you had. But again, as I mentioned, with option 1, it did not cover prescription drugs. So around, as I said, Part D, Medicare Part D came in around January 1st, 2006, and it would allow private companies to provide Medicare standard prescription drug plans. They pay a monthly premium. You might have a deductible. You might have no deductible on certain medications, and they rank the medications depending on the cost and the expense. A really cheap, inexpensive generic medication, the plan may not cost you nothing, $1 or $2 a month, or zero premium, a copay for your medication. So option 1 in the wonderful brochure that we have, if you can see it now, let me just put it up there. A person would get a Medicare supplement plan to be in the $150 to $200 range, plus their Part B premium, as Lisa said, $144.60. And you could add a prescription drug plan. The monthly premium this year could be as low as $13.20 up to about $80. So there's a wide range, and you say, well, what's the big difference? The way, as a licensed agent at Owen Insurance Group, how we determine the best Part D prescription drug plan for someone is we would get compile the list of all their current medications, get the milligrams, the dosage, how much usage they have, and the pharmacy that they like, and we put it into our formulas here and our guides, and we're able to pick from a variety of, sometimes 20, 30 different prescription drug plans in the area. We're able to help them find the best cost for the premium plus the cost of their drugs at, say, Walmart pharmacy or CVS or Walgreens. Whatever pharmacy they like, we find a pharmacy and a drug plan that will give them the lowest cost. Okay, so now if you have a purse, your purse now has 3 cards in it, right? But you have pretty much complete freedom. You're in the driver's seat. Medicare supplements, if you can afford it, and it really does give you control over your health care. One of the limitations, it does not include any dental. It does not include any vision. And I'm getting to option 2 here, because some of you have seen TV commercials, and you may have seen Joe Namath talking about it. More benefits, dental, vision, free gym, silver sneakers, gym membership, over-the-counter meals. Get more benefits on these 0 premium cost plans. This is not the Medicare supplement. So Medicare supplement, you would have to have potentially additional coverage like a dental and vision plan, which you can buy a separate dental and vision plan to supplement those things. So any questions on option 1 before we move on to option 2? Okay. Again, feel free to stop me at any time. Now, as Lisa said, or kind of indicated, for some people, they see that $144.60 for their Part B premium. They see $150 to $200 for their Medicare supplement, you know, $13 up to $80 per month for their Part D drug plan. And they say that's just beyond my budget. Or they say, oh, I can afford that, but I never go to the hospital. I've got people literally, one person said, I haven't been to the doctor since I was like 20 years old. I met with them last week. I just couldn't believe it. They said, maybe 26, maybe before we got married, dear, and there's husband and wife, and they have not been to the doctor. They don't take any medications. And I said, so literally, when's the last time you saw a doctor? Said, I can't even remember. And they're 65, you know, and so they say, I'm not putting out that kind of money. And they say, give me that plan I see on TV with Joe Namath. 0 premium. I get dental, vision, gym memberships. I want it all, and I don't want to pay for it. Okay. So that would be what we have on this nice brochure as option 2. Okay. You can take a moment to look at that, but I'll explain it. And it is what's called a Medicare Advantage plan. And if you've seen the commercial with Joe Namath, I call it the Joe Namath plans. And that would use another letter. You notice I had A, B, and D. I skipped over C. Well, these Medicare Advantage plans, they're offered by private companies, Humana, Aetna, Cigna, Freedom, United Healthcare, these different companies. And they put together an all-inclusive, you can say C for complete, it's Medicare Part C. It's a plan that must comply with Medicare rules. It must cover all the benefits of original Medicare Part A and B. Most of them will include prescription drugs. You can get them without drugs if you don't need it. Some people who get drugs through the VA or other ways don't need a drug plan. So you could get a Medicare Advantage plan that does not include drugs. But most 90% of them include prescription drugs, so you don't have that monthly premium for an extra drug plan, and it will offer additional benefits. And again, there's where Joe Namath comes in. You know, get more benefits. So these additional benefits above and beyond what Medicare would normally cover would be a annual physical. Now, there's a wellness check and wellness exam every year in Medicare, but this would be a full-on physical. Is covered in these Medicare Advantage plans. Silver sneakers, it's a gym membership that many people know about. Over-the-counter benefits where you can get pharmacy credits, where you can buy pharmacy products, ibuprofen, aspirin, ACE bandages, Bengay, all the different things that are not covered by Part D. They give you money maybe every quarter or every month where you can buy pharmacy products. It's called OTC, or over the counter. So even chiropractic services or eye exams for glasses. Some even give you credit up to $200 for glasses. What else? Dental. Most of them are including preventative dental, meaning 1 or 2 cleanings a year, X-ray once a year, and etc. And others are now have comprehensive dental, where you could get up to $1,000 or more per year in dental coverage. So for people on low income, or people who have lots of money who just do not just say, I'm fine with a plan. And these plans are divided into 2 categories. And most of you will recognize these acronyms if you've had any type of coverage or through an employer or through the marketplace. And they're divided into 2 types of plans. One's called an HMO and one's called a PPO. All right, so Does anyone know the difference? Now you can unmute if you would like and see, give you a little question here. Does anyone know the difference between an HMO and a PPO?
Isn't an HMO, I mean, a PPO is like a preferred provider option where you can kind of choose your provider and the services rendered?
Okay, yes, Amanda, you're correct. And do you know what an HMO is?
No, not offhand, no.
Okay, and that's okay. No, very good though. Thank you for answering. I appreciate it. So, and I've personally been,
health
yeah.
maintenance organization, right? So you have to
That
do everything within Cigna or within whoever.
That's exactly right. Thank you. So we got the two basic understandings of an HMO versus a PPO, and this is how these Medicare Advantages come. You know, either in an HMO form or PPO form, and there's a few others that really don't apply for here in our counties or here in the Treasure Coast. But an HMO is a health maintenance organization, and the best way to know it is this: you must have a primary care doctor. Majority of those HMO plans require a referral from a primary care doctor to see a specialist. So you can't just pick up the phone and say, I want to go see my cardiologist or my dermatologist. You have to have a referral sent in by the primary care doctor. It's like a gatekeeper. They help to organize and your health care. And so with an HMO, they're going to send you a booklet, as Lisa said, whatever. They're going to say you got to stay with your Cigna, your Aetna provider. So they're going to send you a provider directory that's going to say, here's who you can see. And unless it's an emergency room or, you know, you're out and about and you can't get to an in-network facility and there's an emergency, otherwise you're going to pay out of pocket if you don't use one of our providers. So basically you have to stay in the network. That's an HMO. Restrictive, but because it's restrictive somewhat, and you have to have these referrals, they try to keep the cost down for the insurance company. Because of that, they give you typically more little benefits. They give you more money for your glasses. They give you more money for dental. They give you more, like, you know, the Joe name it, all the extra benefits, because as a health maintenance organization, they're kind of controlling when you can see. And the primary care doctors, you know, they want to stay in good standing with the insurance company, and they're going to make sure they're really only referring someone to a specialist if it really needs to be done. Okay. Now, the PPO, as Amanda was saying, it's a preferred provider organization. And what that is, it does have in-network doctors. And you might have a copay to see that, you know, primary care doctor, you may pay $5 and see a specialist at $35. But with a PPO, you number one, you don't necessarily need to assign, you don't have to have a primary care doctor. You don't have to have a referral from a primary care doctor to see a specialist. And if the doctor's not in that provider directory and they're willing to accept payment from your company, you can go see an out-of-network provider. Does that make sense? So you have in-network benefits and typically lower costs, lower copays and cost share. But if you go out of the network, as long as those doctors and providers will accept the payment from your plan, you can actually go see them. So you have in and out of network benefits. Again, an HMO being more restrictive, they try to keep the cost down low for the insurance company and for everyone. Therefore, they're able to add a little more benefits to that.
And I'm imagining the cost on these vary wildly depending upon what kind of perks and how restrictive it is. But if somebody were budgeting, is this like $50 that they should budget all in? Is it $200? Or I guess it just depends whether or not they go to the doctor, right?
Now, when you say budgeting, do you mean for the monthly premium for these or for the out-of-pocket maybe copays that they might have?
It'd be great to know everything, but that would be a complete guess. So let's just talk about premiums. Roughly how much in premiums are we talking?
Yeah, very good. And I'll address your point as well. But with premiums, now I'm speaking on the Treasure Coast and South Florida, and typically, let's just say almost all of Florida, we have, I believe, 27 Medicare Advantage plans in St. Lucie County, and probably the same amount in Martin County. I'm not sure where everyone's from, but approximately 27 Medicare Advantage plans. And the majority of them, 80–90% of those, have a 0 monthly premium.
Well, that's good.
Yeah. So people.
That's the first good news of the night.
Well, it is.
You said that earlier, though, didn't you? Yeah, you said that earlier. Okay.
Well, but inevitably, when you tell somebody, you show them all the benefits, all the, it's like getting an insurance plan from your employer, and you're looking at it, wow, they're not going to take any money out of my paycheck. I'm only going to, if I see a primary care doctor, if it's an HMO, if I see my primary care doctor who's in network, I pay 0 copay at the doctor's. I pay $20 for the specialist, and I'm getting all these benefits. But inevitably, many people will say, well, my daddy taught me, if it sounds too good to be true, it is. You don't get nothing for free.
Yeah, that's what I was wondering. I was like, what's the catch?
What's the catch? There's no free lunch.
Yep.
And I got to say, in life, there is no free lunch. Somebody's paying for it. And you remember all that money they started taking out? For me, I remember they started taking out when I got my first check at Shakey's Pizza Parlor in Baton Rouge, Louisiana. Well, all those years that I paid into Medicare, I paid into the Medicare system. And now, if I joined one of these Medicare Advantage plans, the Medicare pool of money will, let's say I sign up for Aetna, and I join an Aetna Medicare Advantage HMO. Now, Medicare is going to give Aetna a big pot of money, a certain amount every month, because Tom Bouvier, all of my Medicare benefits are being run through that. You remember on option 1, you had to carry your Medicare card, your Medicare supplement card, your prescription drug card. You might even have a dental and vision card. You could potentially have 4 cards in your wallet or purse with that option. Now, that gives you the great freedom and all the benefits and pros of that. But with the Medicare Advantage plan, you potentially only have that 1 card. You leave your Medicare card in the safe at home, and it covers, you hand that to the hospital if you go in. You hand that to the pharmacy when you pick up your drug. You hand this to the dentist when you go get your cleaning and potential other work done. You hand this to the optometrist when you go get your free eye exam and potentially glasses made. And, to the gym, you want to go to LA Fitness? Well, it's part of the plan. You got a free gym membership in there. So the Medicare pays these private companies, and that's why you're seeing advertisements on TV if you watch TV, and between October and December 7th, October 1st, when they can really start advertising, open up advertising for 2021 Medicare Advantage plan, you're going to see everybody trying to one-up one another. We're not only going to give you a free eye exam, we're going to give you $200 for your glasses and include it, and we're going to give you acupuncture. I mean, they're just juicing up these Medicare Advantage plans, enticing people, because every person that joins Medicare gives them a plow of money, and that's how these private companies make money. And they're regulated, and as far as have strict guidelines for Medicare, to make sure they cover all the Medicare benefits that people deserve. So.
Are there deductibles on these, or any kind of a cost share? It's just the copay and that's it?
Well, very good. You're asking great questions. I appreciate it, Lisa. And we did not practice beforehand, but she's coming up with a great question. Oh, yeah. And actually, that is a great one, especially because how many of us have had insurance either through our employers or the marketplace, and, we're paying this exorbitant amount, and they said, well, you have a $5,000 deductible. The plan's not going to pay a penny until you pay the first $5,000. Well, the good news on the Medicare Advantage plans, Now, I'd say I've only seen one company in St. Lucie County and Martin, and I won't name the company, that has a medical deductible. Almost all of them, well, 99% of them have a zero medical deductible. So many of them would be zero monthly premium, zero medical deductible. And when you go to a primary care doctor, you might have a $5 or $10 copay or zero. Go to a specialist, it could be as low as 20 up to 35. And if it's a PPO, you go out of network, you're going to pay more. So on a PPO, as Amanda mentioned, the PPO, you can go to pretty much anyone that'll take it. Instead of paying $5 for primary care, you might pay $45. Instead of paying $35 for a specialist in network, you might pay $70 out of network, but at least you can go. And so, and then if you go into the hospital, you may have $250 a day for the first 4 days, and then that's it. Durable medical equipment could be 20% cost share. So you might have lab work might be zero, x-ray might be $7. So you would have all these, co-pays, and that's another reason some people don't like Medicare Advantage plans, is because they like the Medicare and Medicare supplement, because they say, I don't want to be nickel and dime to death. I've got lots of money, but I don't want they're going to bill, give me this. So for the medical, Lisa, most of the Medicare Advantage plans have a zero deductible, and we have a lot of great plans in the area that have that zero deductible. Only a few plans have deductibles for medical. Now, since the Medicare Part C plans, Medicare Complete plans, Medicare Advantage plans, however you want to call them, because most of them include prescription drugs, sometimes they will have deductibles on their medication, So they might not have a medical deductible, but if you get a brand medication, and typically medications are ranked, most commonly it's in 5 levels or tiers, T-I-E-R-S. And I like to describe tiers as like a 5-story building. The first floor you walk in, that'd be like the preferred tier 1, preferred generics. I mean, the cheapest medications out there. You can get a 30-day supply. The real cost is like $2.30, and the company gives it to you for no cost. Tier 2 would be a generic. Tier 3 would be a preferred brand. Tier 4 would be a non-preferred brand, a non-preferred drug. And Tier 5, the most expensive on that 5-story building, Tier 5 medication would be specialty drugs. Many times it's cancer drugs, HIV, new drugs coming on the market that are very, very, literally can be tens of thousands of dollars per month in their cost. So these drugs might have a deductible on all 5 tiers, where you pay the full cost of the medication until you reach the deductible. But many of them have maybe a deductible on tier 3, 4, and 5, the most expensive medication. So I've seen people with 10 to 15 medications, and they're all tier 1 and 2. So they're either paying a couple of dollars a month for tier 1, or nothing, or zero, and maybe $3 to $5, $6 a month for tier 2 medication, and there's no deductible, just straight copay. Okay. I know we're using a lot of insurance terms, but that's what we do. And again, in person, when I do meet with people, I try to make it real clear, spend as much time as they need to understand the options. The option 1 with the original Medicare, Medicare supplement, Medicare prescription drugs. Also, you could get a dental and vision plan. Or option 2, which combines everything, Medicare Part C.
Now, people who do what you do, are they licensed by state, like a regular, like what Bianca does? I know she's only licensed in certain states. Are you the same way?
Okay, correct. I have a home state. Every health insurance agent would be licensed in their domicile, their home state. So my home state is Florida. And I did work previously for a company, and I only specifically worked with one company. So they bought and paid for all my license in all 50 states.
Oh, nice.
A little for over 4 years. So those would be called non-resident license. So if I'm going to sell to somebody in Missouri or North Carolina, Maryland, Louisiana, and I have maintained a certain number of those, and I have clients in other states. So I have to be both licensed in that state, and then let's say I'm with United Healthcare, I have to also be what's called appointed with United Healthcare in North Carolina before I can enroll somebody in a United Healthcare plan in North Carolina or Maryland. So yeah, our license, and we have continuing education classes we have to take every 2 years, and a lot of certifications every year for the Medicare plan. So we do a lot of, I mean, I'm in the midst of taking all the courses and certifications for 2021 Medicare Advantage plans. I'm already finished, I think, five or six carriers so far. Plus, yeah, anyway.
Oh, sorry. So I have a lot of people that I know that I've connected with. Since I moved down from Atlanta, I have a lot of Georgia connections. I know Kay's in Georgia. There's a lot of other people in Georgia. Is Georgia one of your, I know you said all 50 states. Do you have pretty good comfort with Georgia as well?
Absolutely, absolutely.
Okay.
Own insurance group. So I'm an independent broker, but I'm under the auspices or under a broker, Gary Owen Insurance Group, and that we are licensed in Georgia for Medicare products. Absolutely.
So would you personally be able to help them, or would you refer them to somebody with Owen in Georgia, or how would that work?
No, I have, actually, I'm about to enroll somebody in Georgia. Well, I shouldn't say about, he's turning 60. I've been working with him for over a year, but he doesn't turn 65 till November. And I've already have him, but anyway, I'm taking care of him. So I've got clients in North Carolina, Maryland. So we do a lot of it over the phone nowadays. You can do applications, email it to them, they electronically sign it. And so a lot of my clients I haven't even met yet. I mean, I love to meet people face to face. Oh yeah, I mean, probably 30–40% of my client base, even locally. Some people, they live in Stewart. Say, no, just email it to me. I've got someone in Palm City. Oh, no. I mean, they're elderly. They're hard to get out of the house, and they're computer savvy. So we review the plan options. What I do, I'll get a list of all their primary care doctor, all their specialists, all their medications. If it's a Medicare Advantage plan, I say, do you have a preferred dentist, eye doctor? Do you have a gym? I mean, I do a full needs dialogue.
Wow.
I listen. And that's one of the compliments I do get, and I guess I pride myself on. For someone who feels very impatient sometimes, many people tell me I am patient because I really want to get it right the first time. That's so important, to get it right the first time by getting the names of all and then finding a plan that their doctor, if one of their specialists is not in the network and they want the HMO, I disclose it. I tell them, you want to we can find a new specialist, or we need to find a new plan.
Yeah, that's a huge benefit, being able to, I'm sorry, I totally jumped in on what you were talking, but it's a huge benefit being able to outsource some of that analysis, because that would be really overwhelming and confusing. I can just imagine trying to go through the booklet or trying to go on the website and try to figure out, like, all right, well, this plan allows my doctor, but not my, I don't know, podiatrist, right? Like, I got this and not that. But just to be able to say, Tom, you do this for a living, you solve the same problem every day, especially if somebody's local, already the doctors and who's taking which plans. Can you just figure it out for me?
Exactly. Of course, we follow HIPAA regulations and guidelines. We don't give out personal information. We protect it, personal health information as well as personal identifying information. And I have an individual who, one of their Moffitt Cancer Center over in Tampa. I've been working with this wonderful lady for almost over a year now. And I've provided other insurance products that she wanted and needed, and she's been wanting to give me her Medicare business, but Moffitt Cancer Center is only accepted by the Medicare Advantage plan she's in. She wants to get off that plan because she doesn't like it, but the one that would be the best for her, unfortunately, does not take it. And it's
I
not
see we
enough.
have a question from Gary, and I think that might be Mr. Owen himself. So Gary, I think you're unmuted if you want to go ahead.
Hey, Lisa, thank you. Tom, great job, by the way. I have a question for you. Are the Medicare supplement rates in Georgia less premium than in Florida?
Well, Mr. Owen, I would have to do a little bit of research and get back with you. And if I may ask your date of birth, the zip code that you live in. No, so off the top of my head, you know, it's like Henry Ford said, I don't always put all that information up there because I've got to pick up the phone and somebody could tell it to me in 2 minutes. I could find it for you in about 2 minutes.
So,
but if you know the answer, please go ahead.
I'll surely answer with you because I've got 13 years of this, so I could probably help out with that. So, Lisa, in Georgia and many other states in the South, consumers in those states can buy a Medicare supplement. The same Medicare supplement you buy in Florida, you can get in Georgia and many of these other states for about probably a third to 50% less, just FYI.
Wow, and is that because there's just so many retired people in Florida? How does that work?
Yeah, because of the claims, absolutely. I mean, the more people you have, you know, California, the premiums are higher usually. Florida is one of the probably the main states where the premiums are highest. In certain other states in the Northeast, the premiums are higher. So Tom now knows 99% of Medicare now, and the answers. But also, to his point about Medicare Advantage, you know, I always say that zero premium, and he was spot on about Medicare Advantage. Zero premium doesn't equal zero cost. So that's a trap that a lot of consumers fall in. And then, you know, I had a client that, or actually a friend whose father was in a hospital here in Martin Memorial a couple nights ago, and he's on a Medicare Advantage plan. Unfortunately, the doctor who's performing the anesthesia was not in network, and some of the other doctors were not in network. So this guy who has the Medicare Advantage plan is now facing exorbitant out-of-pocket expenses. So like Tom said, it's important to get it right the first time because the decisions you make today will certainly can last a lifetime.
Thanks, that's horrifying.
Well, you know, it's the good, the bad, and the ugly of Medicare, Lisa.
Yeah. I really thought, oh, I can't wait till I'm 65 and I don't have to think about insurance anymore. I knew that there were prescription drug plans because I've seen the ads for them, and I've probably seen the ads for the supplement and the Advantage. I kind of didn't know what that was, and it's not really applicable to me yet. So I was just like, yeah, once I turn 65, everything's free. It's gonna be great. No, I was very uneducated on this, so I'm really glad. I probably shouldn't be announcing it while we're recording this, but I'm really glad that Tom came and shared with us because this has been really disappointing.
Well, I don't know about disappointing. I'd probably call it enlightening.
Yeah, but I get it. It's good to know earlier rather than later, so you can build that in. You know, hopefully most people that are able to, that are working towards retirement, are working like somebody from Brent, from our BNI group, a financial planner or financial advisor who's kind of projecting all this out, and somebody that works with people that are getting prepped for retirement would have some information. They're working with people that are already retired, so they would kind of know, okay, you're going to need to build in, make sure you have coverage. But for people that are DIYing, and I don't do that specific retirement planning, that's not my department. I am usually kind of working with people now, and we talk about retirement just in the sense of you should start getting ready for that, you should start saving, you should start investing, you know, kind of projecting towards it. But I don't get into like what's your exact budget going to be 20 years from now. But it's really good to know, because I would guess a lot of people my age are probably just kind of thinking, okay, I'm going to have this much invested, so that'll mean about this much I can pull out, plus about this much from Medicare. That's roughly equal to my current expenses. That should work. But you've got to build in a whole budget category for healthcare as well. So that's very interesting.
That's true.
That's right. Well, oh, and I know Gary's correct. Now that he mentioned the rates, it's been amazing how I actually have a client in North Carolina, and his wife is going on Medicare in September, and I was looking at the Medicare supplement cost for the different plans, and he's right. It was literally almost half. It was like $98 for a plan that cost $180, $169 here in Florida for the Medicare supplement. So
yeah, just to give some encouragement to those who do want to retire in Florida, we don't have any state income tax.
That's right. That's right.
So that helps, but yeah, that's interesting. And you wouldn't think it really matters because this is a federal program, but I guess most of these things are administered by the state, right?
I'm sorry, say that again. I was looking at.
But even though Medicare is a federal program, it's administered state by state. So that's why there's such a difference in the cost.
Well, yeah, and the individual rates can be different for the Medicare supplement and drug plans by region. And they're called the service areas, but typically it's by the state, but sometimes 2 or 3 states can make up one service area for the Medicare plans. And depending the offerings, sometimes companies will pull out of an area because they're losing money by the bucket loads, and they're just not, hey, this Medicare Advantage plan, we're not offering it anymore. They're rural areas where there's not enough network of doctors and providers. Other areas, typically some inner city that are just really not the companies can't make any money. And I do want to get this, Kay, you had a question, how far prior to 65 should one start looking at Medicare plans, 3 months or 6 months? Given the option, 6 months. 6 months, because an advisor like myself or Gary, we're able to help prepare you before you can actually enroll in a plan. Now, you put 3 months there because typically for when somebody's turning 65, they have a 7-month window, 3 months prior to the month that they turn 65, and then 3 months after. That's called their initial election period or initial enrollment period. So you can get your Medicare card 3 to 4 months before you turn 65. And there's some rules on that. If you're already drawing Social Security, say somebody draws Social Security early between 62 up to 65, they would automatically go on to Medicare and get a card mailed to them about 3 to 4 months before they turn 65. But looking at Medicare plans, 6 months. I mean, and if you know someone or family, friends, colleagues, or yourself, I'm not sure who, age, and but certainly Lisa has my information, but you could reach me. I'll just give you my phone number now if you don't mind, 772-233-6884. That's 772-233-6884. Our office here at Owen Insurance Group is 772-210-1020. And my website is www.tombouvier.com. That's TOMBOUVIER, tombouvier.com. And we're here to help.
Kind of fast, but if somebody retires early and they start pulling Social Security early, then they can enroll in Medicare early. Did I hear that?
Well, yeah, and I didn't go through how a person can apply for Medicare. So there basically several scenarios, rather. Let's say you're about to turn 65, and with now let me back up. With Social Security, you can draw your Social Security benefit check starting at age 62. That you may or may not be aware of that. And then they have a full retirement age for most of us. It's about 66 to 67, and you would get the maximum amount of money. But if you draw early, your Social Security benefit check as early as age 62, and then you're drawing that, and then all of a sudden your birthday, age 65, Medicare will automatically mail you your red, white, and blue card. You don't have to apply for it. The next scenario is you're working, you're 65 and you're working until 70, or you're working until 68. or you plan to keep on working until you're dead. You just love your work. So you will get, so you would have to go on the website, socialsecurity.gov, and sign up for Medicare. You can get Medicare Part A, but if you're working and you have a employee coverage, you can delay your Part B, so you don't have that $144.60 premium. So if you have insurance through your employer, credible coverage, that's covering your healthcare needs and your drug needs, you can just get Medicare Part A because it's premium free. It doesn't cost you anything. And then when you're ready to retire, let's say at 67 or 70, you would have to apply for your Part B. So that's why some people could have their Medicare Part A could start, let's say 10/1/2020, and they retire 2 years later, and their Part B, because they don't want to pay the $144.60 if they have really good insurance at their company, right? So they delay their Part B, and they would have to call Social Security, go to a Social Security office, or go online, socialsecurity.gov, and sign up for their Medicare benefits.
Although I would say, look at your paycheck stub before you, this is probably obvious, but just be sure to look at your paycheck stub before you make that determination. Right. Because you may be paying more than $144.60 for your employee coverage. They may be taking more than that out of your paycheck. So
that's right. There's a lot of factors, and that's where Gary and I, as licensed agents, and we provide people service with what's called a fiduciary responsibility, meaning we're only going to do what's best for them, what's recommended best for them. We want them to get it right the first time that's best for them, because not only do we believe in karma and what goes around comes around, but we want these people's health is on the line. And some people, if they get into Medicare Advantage, they can't keep up with the copays, and the out-of-pocket expenses. And there is caps and limits on Medicare Advantage, but and they can afford the supplement. Man, going to the doctor or not going to the doctor, it could depend on the decision we help them make, and as well as Social Security timing. We're trained in helping people decide when they should help them make a decision of when they should take their Social Security at age 62, age 67, all the way up to age 70. So there's a lot of things in the Social Security. We're trained in the Social Security timing aspect of things as well.
Oh, that's good to know. I didn't realize you all did that. So that's very good information.
Yes, I have not. Yeah, that's right. So that is something we can help people, even have a Social Security timing worksheet and provide them, and they can see, should I take it at 62? Should I take it at 65? Should I take it at 67 or 70? A lot of factors go involved or go into making that decision, and we can help with that as well.
That's awesome. Well, I know we went a little bit over, but I guess there was a lot more to this than I realized. So I really appreciate all the information. I'll give just a quick second. If anybody has any burning questions, go ahead, unmute yourself, ask while we're all gathered.
So I have a question. So I'm nowhere near retirement age. I'm actually 35, but I'm on this call because my mom, she's 67 and she's still working. And so she was asking me, because open enrollment is coming up, she doesn't plan on retiring until like another 2 years. So she was wondering, because you had mentioned that you don't necessarily have to apply for Part B if you're still working with your employer. So it would depend on what she's actually paying for from her employer to cover the cost that Part B would cover if she's not going to retire, right now.
That's correct. That's one of the factors. Also, another factor, Amanda, thank you for that question, is what kind of coverage is she getting? Because some employee coverage is really good and it does not cost the employee too much and they really like it, or they're comfortable with paying a portion of that plan. And also, does it cover prescription medications? And I'm assuming the majority of good health insurance by an employer does include medications, but since she has Medicare Part A, and if she's only getting medical, let's say she doesn't have any drug coverage through her employer, she does qualify. She could add a Part D prescription drug plan if it's not being covered by her employer. So a person does not have to have Part A and B to get a drug plan. They do have to have Part A and B to get a Medicare Advantage or a supplement plan. So, you know, if she's comfortable with the insurance and whatever cost may be, and she feels it's a good plan, and she's not having to pay that Part B premium, she could add a drug plan if potentially if it would help. But if not, she got the coverage, she may just stay with what she has till she retires.
And then my next question is, as far as, so my mom actually lives in Florida, so she'll be retiring in Florida. So my question is, like, consultations like with you, as far as like your compensation, is it like I know you said it was free to do, like a free consultation, trying to make sure I got it right. No charge for the consultation, but after the consultation, so how do you get, like, so how does that work?
Well, I'm really a self-made billionaire, so I'm just doing this all for the well-being of all the wonderful
You're a nice guy, but you're not that nice, Tom.
Correct. So thank you, Amanda. And actually, I get asked that question a lot because we do, you know, for Medicare planning and reviews, no cost, or no obligation to enroll. And Amanda, the way we get compensated is for the insurance carriers themselves. And so for the Medicare Advantage plans, for example, there's a set amount that Medicare approved commission and compensation to agents. So it's the same whether I enrolled a person in recommended Aetna, United Healthcare, you know, Cigna, or whoever. So I don't have a financial incentive to put everybody with one company. You know what I'm saying? So we get compensated straight from the insurance company, you know, so that's how that works.
But it's the same amount regardless of which company the client ends up going with?
For the Medicare Advantage plans and the prescription drug plans, correct. Yeah.
Okay, and then this is where the fiduciary piece comes in, because for anything else you talk to them about, if you've got that fiduciary responsibility, you have to put their interest ahead of your own, correct?
Absolutely. And yeah, I was going along those lines, saying that earlier, and you know, not only do we believe in karma and doing right by people, but there's legal ramifications if we were to do things unethically and recommend things that really was definitely not in the best, and they complain to Medicare, and we want people to be happy with the plan, and if they like our services that what we explained to them and recommended, they would of course share our information and send their family and friends.
And is that fiduciary requirement, is that for everything you do, or is that like just for certain pieces? Because I know in the financial advisor world, they like to talk about this hats thing. They're like, well, I'm going to take off my fiduciary hat right now, and I'm going to go sell you this annuity where I get a lot. They'll talk about that. They'll like go in and out of fiduciary rules. Do you guys do that, or is it for everything?
No, as an insurance agent, I mean, I have the life. There's 215, you know, you have the life, health, and variable annuities, so we can do it. And in our world, everything is fiduciary responsibility. I mean, and especially if there were financial life insurance products that had, permanent and whole and annuity, some kind of index. We have to fill out a lot of forms saying, here's why we believe this person. I mean, there's a lot of accountability. And even in a simple dental and vision plan, I mean, I review and look at 4 or 5 different ones and see which ones are best for them, gives them the best coverage. And I want them to be happy clients. I mean, I'm not, so anyway.
Because you want the repeat business and the referrals as well, right?
And I want to sleep at night as well, and stay out of jail. I mean, we've all heard of the stories of Medicare fraud, waste, and abuse, and that's typically by providers and medical equipment companies. But agents get in trouble too by being not acting in a fiduciary responsibility way, and doing things that are just unethical. So, Amanda, did I answer your question, or did you have anything else?
Yes, you did answer it. Thank you very much.
My pleasure.
Anything else from anyone else? Maybe Kay, you got any questions? I was trying to give her a second to unmute, but I haven't seen her unmute. So, well, Tom's got his information here. Do you want to give just for the folks that are watching the replay, they won't probably see the side chat, but can you give your phone number and your website one more time, and then we'll let them know.
Sure. Thank you so much. Again, my name is Tom Bouvier, Owen Insurance Group. The best way to reach me is on my mobile at 772-233-6884. 772-233-6884. Visit my website at www.tombouvier.com. That's TOMBOUV as in victory, IER.com.
Wasn't that Jackie O's maiden name?
Sure was. Yep.
Is she a cousin?
My grandmother, my little old Cajun grandmother, would sit on her porch with her cigarette and beer in her hand and say, yeah, one day we're all going to be rich. Jackie O's going to die. She's our 16th cousin. But, you know, as of yet, they have not found me, and God rest her soul. You know, Bouvier is a French name. There's a group, a lot of Bouviers up north, the northeast, of which Jackie O came from. Jackie Onassis Kennedy, married to John F. Kennedy. That was her maiden name. And then there's Southern Bouviers that came directly from France to New Orleans.
Oh, cool. Okay, so probably related, but pretty far back.
Yeah, maybe somewhere way back in France.
Yeah. So, all right. Well, unless anybody else wants to jump in real quick, I will let you go for the evening. If anybody wants more information from Tom, you've got his information. And if you want more information on topics like this, insurance, healthcare, personal finance, anything related to that, join us in the Money Club. There is a Facebook group. You can get a shortcut to it at lisaduke.net/moneyclub. I go live there every Monday at 6 p.m. Eastern, and we've now added these Tuesday talks on Tuesdays, obviously, also at 6 p.m. Eastern. And I am also available to help you, especially with your limiting beliefs, money blocks, more the woo-woo side of money. So you can find me either through the Money Club or at my website, lisaduke.net. And so, Tom, thank you so much. And thank you for the special guest star, Gary Owen, popping in with the cameo. And I will see everybody later. Take care. Have a good night.
Thank you all. Thank you, Lisa, Amanda.
Bye.
Bye-bye.